Hello, students. We have to discuss today the diseases with the predominance of the contact mechanism of transmission, and the most dangerous of such group of diseases are hemorrhagic fevers, and especially viral hemorrhagic fevers. And today we will start to speak exactly about them.
Viral hemorrhagic fevers. What is viral hemorrhagic fevers? Viral hemorrhagic fevers refers to a group of illnesses caused by several distinct families of viruses that affect humans and non-human primates. Viral hemorrhagic fevers is a severe multi-system syndrome characterized by diffuse vascular damage. Bleeding often occurs and, depending on the virus, may or may not be life-threatening. Some viral hemorrhagic fevers cause mild disease, while others may cause severe symptoms and death. Viral hemorrhagic fever viruses are members of 4 distinct families: arenaviruses, filoviruses, bunyaviruses, and flaviviruses. They are all RNA viruses that are enveloped in a lipid coating. The survival of these viruses is dependent on their natural reservoir, which is in most cases is an animal or insect host. The Arenaviridae family, you see, contains the following viruses: Junin, Machupo, Sabia, Guanarito, and Lassa. Lassa that belong to especially dangerous infections. I hope you remember from the practical classes. The Bunyaviridae family include Crimean Congo hemorrhagic fever, hantavirus, okay, I see, hantavirus, and Rift Valley fever. Marburg and Ebola. Marburg and Ebola belong to the very dangerous and interesting family of viruses like Filoviridae. Yes, you see, Filoviridae family. And Flaviviridae is very interesting also, and a very big family of viruses that include Cassianur forest disease, new and also interesting for research. Omsk hemorrhagic fever, no, maybe not new, but also strange disease that still present just in Omsk region, and that's why very interesting exactly for investigation. And you can see yellow fever, very big and dangerous hemorrhagic fever that was in the previous times, we will speak later. Dengue, the most maybe spreading in the tropical regions, and new virus Zika. You understand, yes, what does it mean, Zika? We also were speaking about this during practical classes. And now we will start to speak about each family shortly, and at the end of the lecture we will discuss the Ebola, and I will show you some slides about the outbreak of Ebola in 2014. Arenaviridae. Junin, Machupo, Guanarito, Sabia, they all are included into such meaning of hemorrhagic fevers like South American hemorrhagic fevers. And Lassa virus. We will speak about them. The first arenavirus was isolated in 1933 during an outbreak of St. Louis encephalitis virus. In 1958, the Junin virus was isolated in the plains of Argentina in agricultural workers. It was the first arenavirus found to cause hemorrhagic fever. Others soon followed, including Machupo in Bolivia in 1963, and Shoa Lassa virus in Nigeria in 1969. Since 1956, a new arenavirus has been discovered every 1 to 3 years, but not all cause hemorrhagic fevers. You have to understand this. New and old wild rats and mice are chronically infected with arenaviruses. The virus is vertically transmitted from host to offspring, with most viruses in this family. Transmission among adult rodents may also occur through the bites and other wounds. Rodents shed the virus into the environment through urine, fecal droppings, and other excreta. Humans can become infected when coming into contact with rodent excreta or contaminated material, such as contact through abraded skin or ingestion of contaminated food. Isolation of rodent excreta may also result in disease. Person-to-person transmission has also been documented in healthcare settings through close contact with infected individuals and contact with infected blood and medical equipment. Epidemiology of arenaviruide viruses. Arenaviruses are found worldwide. However, the viruses responsible for causing hemorrhagic fever are restricted to 2 continents. Lassa virus is endemic to the region of West Africa, while Junin, Machupo, Guanarito, and Sabia viruses are all found in South America. The latter are grouped together as the Latin American hemorrhagic fevers or South American hemorrhagic fevers. Humans who have frequent contact with rodent excreta have an increased risk of developing an infection with an arenavirus. Who is exposed depends on the type of rodent carrying the virus. Agricultural and domestic exposure are the most common. Case fatality for arenaviruses range from 5 to 35%. Lassa and Machupo can cause explosive hospital-acquired outbreak. Incubation period for arenaviruses is typically between 10 to 14 days. Disease onset begins with a fever and general malaise, as you see, for 2 or 4 days. Most patients with Lassa fever will recover following this stage. However, those infected with Latin hemorrhagic fevers typically progress to more severe symptoms. The hemorrhagic state of the disease quickly follows and leads to hemorrhages, neurological signs, leukopenia can be, and thrombocytopenia. Next family, Bunyaviridae, that include Rift Valley virus, Rift Valley fever virus, Crimean Congo hemorrhagic fever virus, and Hanta virus. Rift Valley fever virus was first isolated in 1930 from an infected newborn lamb as part of investigation of large episodic of disease causing abortion and high mortality in sheep in Egypt. Crimean Congo hemorrhagic fever virus was first recognized in the Crimean Peninsula, located in southeastern Europe on the northern coast of the Black Sea in the mid-1940s, when a large outbreak of severe hemorrhagic fever among agricultural workers was identified. You know where Crimean Peninsula is situated, that's why maybe. But you have to remember that hemorrhagic fever, Crimean, Congo also. Yes, in Africa also is registered. It's very dangerous also in the Crimean region. The outbreak included more than 200 cases and a case fatality about 10%. It's a very high fatality rate. The discovery of hantaviruses traced back, very interesting, traced back to 1951, 1953, when United Nations troops were deployed during the border conflict between North and South Korea. More than 3,000 cases of an acute febrile illness were seen among the troops, about 1/3 of which exhibited hemorrhagic manifestations, and an overall mortality was from 5 to 10%. Was seen. The family now consists of 5 genera, which contain 350 viruses that are significant human, animal, and also can be plant pathogens. Most bunyaviruses, except of hantaviruses, utilize an arthropod vector to transmit the virus from host to host. In some cases, the virus may be transmitted from adult arthropods to their offspring, transplacental way of transmission, yes. Humans are generally dead end host for the viruses, and the cycle is maintained by wild or domestic animals. Crimean Congo hemorrhagic fever virus is transmitted by exotic ticks and domestic and wild animals such as hares, hedgehogs, sheep, and a lot of another. Serve as amplifying and reservoir host. In contrast, Rift Valley fever virus is transmitted by Aedes mosquitoes, resulting in large epizootics in livestock. Humans are incidentally infected when bitten by infected mosquitoes or when coming into contact with infected animal tissues. The virus is believed to be maintained by transoviral transmission between the mosquito and its offspring. Hantaviruses cycle in rodent host, and humans become infected by coming into contact with rodent urine. Aerosolation of viruses and exposure to infected animal tissues are also two less common modes of transmission for some bunyaviruses. Bunyaviruses are found worldwide, but each virus is usually isolated to a local region. Rift Valley virus fever is found primarily in sub-Saharan Africa and was recently isolated in Saudi Arabia and Yemen in 2000. The case fatality rate in humans is generally about 1%. Crimean Congo hemorrhagic fever is found in most of sub-Saharan Africa, Eastern Europe, and Asia. The case fatality rate is about 30%, and nosocomial outbreaks have been documented through exposure to infected blood products. Hantaviruses are divided into two groups based on location. Old world viruses are found in Eastern Europe you see, and Eastern Asia, while new world viruses are found in North and South America. Depending on the virus, case fatality rate can vary from 1 to 50%. Most humans suffering from Rift Valley fever will experience flu-like symptoms and recover with no complications after an incubation period of 2 to 5 days. In 0.5% of cases, hemorrhagic fever will develop following the initial febrile stage. Another 5% of cases will develop retinitis or encephalitis 1 to 4 weeks following infection. Most human infections will occur 1 to 2 weeks following the appearance of abortion or disease in livestock. In contrast to Rift Valley fever, the most humans infected with Crimean Congo hemorrhagic fever will develop hemorrhagic fever. The incubation period for the disease is 3-7 days, and the most patients will develop hemorrhagic fever 3 to 6 days following the onset of flu-like symptoms. Hantaviruses generally cause 1 to 2 clinical presentations, like hemorrhagic fever with renal syndrome, caused by old world hantavirus, or hantavirus pulmonary syndrome, generally caused by new world hantaviruses. Incubation period is from 7 to 21 days, followed by a clinical phase of 3-5 days. Severity of illness is dependent on the virus. Rift Valley fever causes severe disease in livestock animals. Abortion rates can reach even to 100%. Mortality rate in animals less than 2 weeks of age can be greater than 90%, with most animals succumbing to disease with 24-36 hours from the onset of fever. Older animals also suffer from a less severe febrile illness, with mortality rates ranging from 5 to 60%. In contrast, Crimean Congo hemorrhagic fever virus causes an apparent or subclinical disease in most of livestock and is maintained in the herd through the bite of a tick. Rodents are persistently infected with hantaviruses, but show no clinical signs. The virus is transmitted from rodent to rodent through biting, scratching, and possible aerosolation of rodent urine. It's about such Bunyaviridae family viruses in animals, and we will go to the most interesting from this, most dangerous maybe for now, for current situation, family from hemorrhagic fever viruses, Filoviridae. And the filoviridae belong to very dangerous viruses like Marburg virus and Ebola virus. Marburg virus was first isolated in 1967, from several cases of hemorrhagic fever in European laboratory workers in Germany and former Yugoslavia, working with tissues and blood from African green monkeys imported from Uganda. Ebola virus was first reported and simultaneously in Zaire and Sudan in 1976, when two distinct subtypes were isolated in two hemorrhagic fever epidemics or outbreaks. Both subtypes later named Zaire and Sudan caused severe disease and mortality rates greater than 50%. A third subtype of Ebola, Reston, was later found in macaques imported from the Philippines into United States in 1989. And we, as a rule, I try to show to all my groups, we watch the serial, The Hot Zone, and it was exactly about this situation. The serial is on documentary facts about the outbreak of Ebola Reston in 1989 in USA. And also was in 1992 the same situation in Italy. 4 humans were asymptomatically infected and recovered without any signs of hemorrhagic fever. In 1994, a fourth subtype of Ebola was isolated from an animal worker in Côte d'Ivoire who had performed a necropsy of an infected chimpanzee. And also we will remember about another one, virus that not dangerous also yet for humans, no, but everything possible. Filoviruses cause severe hemorrhagic fever in non-human primates. The signs and symptoms found are identical to humans. The only major difference is Ebola Reston has a high mortality in primates, about 80%, 82%, while it does not seem to be pathogenic to humans. No, and about the clinical, symptomatic and epidemiology in humans, we will speak later. And next family, very big family, Flaviviridae family, that include, as you see, dengue virus, yellow fever virus, Omsk hemorrhagic fever virus, and Kyasanur forest disease virus. Yes, don't mix. Flaviviridae contains a lot of another viruses, but now we are speaking about hemorrhagic fever viruses. Yellow fever was first described in 1648 in Yucatan. It later caused huge outbreaks in tropical Americas in 70s, 80s, 90s, and 20th century. The French failed to complete the Panama Channel because their workforce was decimated by yellow fever. Yellow fever virus was first flavivirus isolated in 1927 and the first virus to be proved to be transmitted by arthropod vector. Dengue virus, which was also found to be transmitted by arthropod, was isolated in 1943. Major outbreaks of dengue with hemorrhagic fever have occurred in Australia in 1897, Greece in 1928, and Formosa 1931. Since the cessation of the use of DDT, diethyl, it's like a very dangerous repellent. Now, yes, it stopped using, but it was very serious help to stop exactly this arthropod, especially mosquito and also lice transmission of different diseases. Since the cessation of the use of DDT to control mosquito vector, dengue has now spread to most of the tropical regions of the world. No, and two more hemorrhagic fevers, possible hemorrhagic fevers, maybe not so spreading, but for mutations, for new outbreaks, it's very good possibility. Omsk hemorrhagic fever virus was first isolated in 1947 from the blood of a patient with hemorrhagic fever during an epidemic in Omsk and Novosibirsk regions of the former Soviet Union. Kyasanur forest virus was first isolated from a sick monkey in the Kyasanur forest in India in 1957. Since its recognition, 400 to 500 cases a year have been reported. Flaviviruses utilize arthropod vector to transmit disease. Yellow fever is a zoonotic disease that is maintained in non-human primates. The virus is passed from primate to primate through the bite of the mosquito. This is known as the sylvatic cycle, from animal to animal by mosquito. From primate, yes, primate animals. Humans contact the disease when bitten by an infected mosquito, usually Aedes aegypti, and the disease can then be epidemically spread from human to human by these mosquitoes. This cycle is known as the urban cycle. Dengue virus is maintained in the human population and is primarily transmitted in this manner. Kyasanur forest virus is transmitted by an exotic tick. The tick can pass the virus from adult to eggs and from one stage of development to another. The basic transmission cycle involves exotic ticks and wild vertebrates, principally rodents and insect-eating animals. Humans become infected when bitten by an infected tick. The basic transmission cycle of the Omsk hemorrhagic fever virus is unknown, but an exotic tick are believed to transmit the viruses from rodent to rodent. Muskrat are epizootic hosts, and human infections occur by direct contact with their urine, feces, or blood. Yellow fever virus is found throughout sub-Saharan Africa and tropical South America, but activity is intermittent and localized. The annual outbreak incidence is believed to be about 200,000 cases. Per year globally. Case fatality rate ranges greatly depending on the epidemic, but may reach up to 50% in severe yellow fever cases, and if you are not vaccinated. Dengue virus is found throughout the tropical Americas, Africa, Australia, and Asia. Cases of dengue hemorrhagic fever have been increasing as the distribution of Aedes mosquitoes Aedes aegypti mosquitoes increases following the collapse of mosquito control efforts. Case fatality rates for dengue hemorrhagic fever is generally low, from 1 to 10%, depending on available treatment. Khyasanur forest virus is confined to Mysore state of India, but spreading. You hear? Spreading. Case fatality rate is about 3–5%. Omsk hemorrhagic fever virus, as a rule, still isolated in Omsk and Novosibirsk regions of the former Soviet Union, and case fatality rate vary from 0.5% to 3%. Yellow fever can cause a severe hemorrhagic fever. As I remember with my groups, we try to discuss different moments of yellow fever, and in the previous times it was very dangerous disease. The incubation period in humans is from 3 to 6 days. The clinical manifestation can range from mild to severe signs. Severe yellow fever begins abruptly with fever, chills, severe headache, lumbosacral pain, generalized myalgia, anorexia, nausea, and vomiting, and minor gingival hemorrhages, even from the beginning. A period of remission may occur for 24 hours. It's a silent period, so-called, followed by an increase in the severity of symptoms. Death usually occurs on day 7 to 10. Dengue virus will cause a mild flu-like illness upon first exposure. If the person is then infected by a different serotype, please listen very carefully because it's very interesting. If the person then infected by a different serotype, dengue hemorrhagic fever can occur. The disease will begin like a normal infection of dengue virus with an incubation period of 2 to 5 days, but will quickly progress to hemorrhagic syndrome. Rapid shock ensures, but can be reversed with appropriate treatment. Khyasanur forest virus in humans is characterized by fever, headache, myalgia, cough, bradycardia, dehydration, hypotension, gastrointestinal symptoms, and hemorrhages. Recovery is generally uncomplicated with no lasting sequelae. Omsk hemorrhagic fever virus has a similar presentation to Khyasanur forest virus. However, hearing loss, hair loss, neuropsychiatric complaints are commonly reported following recovery. Yellow fever is maintained in non-human primates. Depending on species, yellow fever may be an apparent infection or a severe hemorrhagic illness. Dengue has been isolated from several non-human primates in Africa, but does not cause clinical signs. Livestock may develop a viremia with Khyasanur forest disease virus, but generally do not show clinical signs. Omsk hemorrhagic fever virus is maintained in rodents, but does not cause clinical signs. And now we will discuss the disease in humans in general, and later we'll speak about the Ebola. Specific signs and symptoms vary by the type of viral hemorrhagic fever, but initial signs and symptoms often include marked fever, fatigue, dizziness, muscle aches, loss of strength, and exhaustion. Here you can see the suspicious of Ebola in small child. More severe clinical symptoms include bleeding under the skin causing petechiae, ecchymosis, and conjunctivitis under the mucosa. Bleeding may also occur in internal organs and from orifices like the eye, nose, or mouth. Despite widespread bleeding, blood loss is rarely the cause of the death. It's not the main cause of the death, the bleeding. Yes, it decreases the state of the patient, but doesn't lead to the death exactly. Clinical microbiology and public health laboratories are not currently equipped enough to make a rapid diagnosis of any of these viruses, and clinical specimens in an outbreak need be sent to the regional or even some central laboratories that are situated sometimes even in the different countries. But what are the main possibilities? It's also you have to remember that it's a very dangerous material, and biosafety all measures you have have been kept, yes, and what such methods can be used, like serological PCR. Sure, it will be the best, but you have to know the agent. Well, just suspect maybe the agent. Immunohistochemistry, viral isolation, and electron microscopy of viral hemorrhagic fever viruses. Treatment, also in general, because as a rule treatment not present, etiological treatment not present. Patients infected with viral hemorrhagic fever receive supportive therapy with special attention paid to maintaining fluid, and electrolyte balance, circulatory volume, blood pressure, and treating for any complicated infections. There is no other established treatment. While there are no antiviral drugs for treatment of viral hemorrhagic fevers, just ribavirin has been effective in treating some individuals with arenavirude and bunyavirude family viruses, but has not shown success against filovirude, like Ebola, or flavivirude infections. Treatment with convalescent phase plasma has been used with success in some patients with Junin, Machupo, and during Ebola outbreak also, but it's still not proved. You see, if infection with a viral hemorrhagic fever is suspected, it should be reported to health authorities immediately. Strict isolation for a patient is also required. Prevention and control. Please, everybody, turn off the sound. Prevention and control. Prevention of viral hemorrhagic fevers is done by avoiding contact with the host species, because many of the hosts that carry viral hemorrhagic fever viruses are rodents. Prevention should involve rodent control methods. Steps for rodent prevention include the control of rodent population, discouraging the entry into homes and safe clean-up of nesting areas and droppings. For viral hemorrhagic fever that are spread by arthropod vectors, prevention efforts should focus on community-wide insect and arthropod control. In addition, people are encouraged to use insect repellents, proper clothing and bed nets, window screens, and other insect barriers to avoid being bitten. The only established and licensed vaccine is for yellow fever, and it's a lot of years already present. This live vaccine is safe and effective and gives immunity lasting 10 and even more years. An experimental vaccine is under study for Junin Machupo viruses, which provides some cross-protection between each other. Investigational vaccines are in the development phase for Rift Valley fever, hantavirus, and dengue. For viral hemorrhagic fevers that can be transmitted person to person, including the arenaviridae, bunyaviridae, excluding Rift Valley fever, and the filoviridae, close physical contact with infected people and their body fluids should be avoided. It's in our possibility to do such things, just to avoid them contact with another persons that may be infected. Так. Anyone suspected of having viral hemorrhagic fever must know also other infection control recommendations include proper use, disinfection, and disposal of instruments and equipment used in treating or caring for patients with viral hemorrhagic fever, such as needles, thermometers, and so on. Place any disposal items, including linens, in a double plastic bag and saturate with 0.5% sodium hypochlorite, 1 to 10 dilution of bleach, you see. Place sharps in the sharps container saturated with 0.5% solution. Wipe the containers with the 0.5% solution and send them to be incinerated. It's about the prevention in general. And now we will start speaking our conversation, our lecture about the Ebola. Ebola, yes, Ebola is very dangerous and one of the most especially dangerous infections in the world. And sure, we have to speak about them. Key facts. Ebola virus disease, formerly known as Ebola hemorrhagic fever, is a rare but severe, often fatal illness in humans. Sometimes rare, sometimes not. The virus is transmitted to people from wild animals and spreads in the human population through human-to-human transmission. The average Ebola virus disease case fatality rate is around 50%. Case fatality rates have varied from 25 to 90% in the past outbreaks. Ebola virus disease outbreaks occur primarily in remote villages in Central and West Africa, new tropical rainforests. The virus is transmitted to people from wild animals and spreads in the human population through human-to-human transmission. Fruit bats of the Theropodidae family are considered to be the natural host of the Ebola virus. Community engagement is key to successfully controlling outbreaks. Good outbreak control relies on applying a package of interventions, namely case management, infection prevention and control practices, surveillance and contact tracing, a good laboratory service, safe and dignified burial and social mobilizations. Vaccines to protect against Ebola are under development and have been used to help control the spread of Ebola outbreaks in Guinea and in the Democratic Republic of the Congo. Early supportive care with rehydration, symptomatic treatment improves survival. There is no licensed treatment proven to neutralize the virus, but a range of blood, immunological and drug therapies are under development. Now some words about history of Ebola virus appearance. Ebola virus causes an acute, severe, serious illness, which is often fatal if untreated. Ebola virus disease first appeared in 1976 in two simultaneous outbreaks, like independent outbreaks. One in what is now Nzara in South Sudan, and another one in Yambuku in Democratic Republic of Congo. The latter occurred in a village near the river Ebola River, from which the disease takes its name. You see here Nzara and Yambuku, but they were different because in Nzara was the strain Sudan, in Yambuku was strain Zaire. The 2014-16 outbreak in West Africa was the largest Ebola outbreak since the virus was first discovered in 1976, firstly, yes. The outbreak started in Guinea and then moved across the land borders to Sierra Leone, yes, and Liberia. The current 2018-19, no, not current, the previous year, yes, but we can say current, 2018-19 outbreak in Eastern Democratic Republic of Congo is highly complex, with insecurity adversely affecting public health response activities. The virus family Viridae, Filoviridae, you see, yes, the virus family is Filoviridae. No, general, you see, yes, a group of RNA virus, order Mononegoviralis, family Filoviridae, and genera Ebola virus. And what species of this Ebola virus? But Filoviridae family include such three genera like Gueva virus, Marburg virus, and Ebola virus, but the most often what Ebola virus. Within the genus Ebola virus, 6 species have been identified. Zaire Ebola virus, that's the most dangerous, you see. Bundibugyo, Sudan, also very dangerous, but less than Zaire. Preston, also Thai forest, or formerly Côte d'Ivoire, but Thai forest Ebola virus. Also dangerous for humans, but not very much. And Reston and Bombali Ebola viruses that are dangerous for non-human primates. The virus causing the current outbreak in Democratic Republic of Congo and the 2014-16 West African outbreak belongs to Zaire Ebola virus species. Structure of the virus, you can see here, single-stranded, linear, non-segmented, filamentous, that's why filoviridae, that's why, exactly, because it looks like filamentous. Shape U or 6, coiled, toroid or branched, 19 kilobyte length, 60-80 nanometers in diameter. Negative sense envelope RNA, spikes also present. You see glycoproteins like spikes, like in coronavirus also spikes present. And you see 8 subgenomic mRNA proteins, 7 structural and 1 non-structural. What here you can see the table of outbreaks, different outbreaks of Ebola, different species, yes, of Ebola. First was in Democratic Republic in 1976, as you see, first outbreak of Ebola hemorrhagic fever. In Zaire, in Democratic Republic of Congo, caused by Zaire, and in Sudan, caused by Sudan types of Ebola viruses. Then you see 1989 in Reston in USA, and the most awful, the largest outbreak was in 2014-16 in West Africa, Guinea, Sierra Leone, Liberia, and Nigeria a little, and maybe already not current, but the most close to us, the closest 2018-19 in Democratic Republic of Congo. Transmission. Ebola is introduced into the human population through the close contact with blood, secretions, organs, or other body fluids of infected animals. In Africa, infection has been documented through the handling of infected chimpanzees, gorillas, fruit bats, also monkeys, forest antelopes, porcupines found ill or dead or in the rainforest. Ebola then spreads in the community through human-to-human transmission, with infection resulting from direct contact through broken skin or mucous membranes, with the blood, secretions, organs, or other bodily fluids of infected people, and in direct contact with environments containment with such fluids. Burial ceremonies in which mourners have direct contact with the body of the deceased person can also play a role in the transmission of Ebola. Men who have recovered from the disease can still transmit the virus through their semen for up to 7 weeks after recovery from illness. Can you imagine? More than 2 months, up to 7 weeks. Healthcare workers have frequently been infected while treating patients with suspected or confirmed Ebola virus disease. This has occurred through close contact with patients when infection control precautions are not strictly practiced. Here you can see the possibility of transmission. In Africa, fruit bats, particular species of the genera Hypsignathus monstrosus, Epomops frankweti, and Mionecteris torquata are considered possible natural hosts for Ebola viruses, what you see here. As a result, the geographic distribution of Ebola viruses may overlap with the range of the fruit bats. Ebola virus in animals, also non-human primates, have been a source of infection for humans. They are not thought to be the reservoir, but rather an accidental host like human beings. Since 1994, Ebola outbreaks from the Zaire and Tai forest species have been observed in chimpanzees and gorillas. Reston has caused severe Ebola virus disease outbreaks in monkeys, Macaca fascicularis, found in Philippines and detected in monkeys imported into the USA in 1989, 1990 and 1996, and in monkeys imported to Italy from Philippines in 1992. Since 2008, Reston viruses have been detected during several outbreaks of a deadly disease in pigs in China and Philippines. Asymptomatic infection in pigs has been reported, and experimental inoculation have shown that Reston virus, Ebola virus, cannot cause disease in pigs, but was observed. Cases were present. Here you can see the average death rates from different types of Ebola viruses, and you see Zaire sure is the most dangerous. Signs and symptoms. Ebola virus disease is a severe acute viral illness often characterized by sudden onset of fever, intense weakness, muscle pain, headache, and sore throat. The beginning like flu-like beginning. Yes, it may be without running nose, that's all, but everything like that. Intoxication, but sore throat present, muscle pain, and exhaustion. This is followed by vomiting, diarrhea, rash can appear, impaired kidney and liver functions, in some cases, both internal and external bleeding. Vomiting blood already, you see, day 10. Day 11 can appear bruising, brain damage even, bleeding from nose, mouth, eyes, anus, from different orifices. Laboratory findings include low white blood cells and platelet counts and elevated liver enzymes. And till the second week, loss of consciousness, seizures, massive internal bleeding, and death can be. It's repeating. 2 weeks, about 2 weeks. People are infectious as long as the blood and secretions contain the virus. Ebola virus was isolated from semen 61 days after onset of illness in a man who was infected in laboratory. The incubation period, that is the time, yes, from the infection to onset of symptoms, is 2 to 21 days. That's why the time of surveillance of all contacts will be 21 days. Now, with what diseases we have to differentiate as a rule in tropical regions is malaria, typhoid fever, shigellosis. Sure, also don't forget, because the feces with blood can be present, diarrhea with blood. Cholera, because vomiting, and also tropical regions, everything can be. Plague, different rickettsiosis, because rash is present. Meningitis, because involvement of brain is present also. Hepatitis increasing, yes, all internal organs are involved. And the diagnosis, yes, Ebola virus can be diagnosed definitely in a laboratory through several types of tests. Antibody capture enzyme like link immunosorbent assay, or ELISA in other words, antigen detection tests, serum neutralization test, and reverse transcriptase, yes, RT-PCR assay, electron microscopy, virus isolation by cell culture. And you have to remember that samples from patients are an extreme biohazard risk. Testing should be conducted under maximum biological containment conditions. Severely ill patients require intensive supportive care, rehydration with oral or intravenous fluid, and treatment of specific symptoms improves survival. There is, as yet, no proven treatment available for Ebola virus disease. However, a range of potential treatments, including blood products, immune therapies, and drug therapies, are currently being evaluated. An experimental Ebola vaccine proved highly protective against Ebola virus disease in a major trial in Guinea in 2015. The vaccine, called RVSV-ZIBO, was studied in a trial involving 11,841 people. Among about 6,000 people who received the vaccine, no Ebola cases were recorded 10 days or more after vaccination. In comparison, there were 23 cases 10 days or more after vaccination among those who did not receive the vaccine. It's varicella vesicular stomatitis virus, Zaire Ebola virus vaccine is ZIBO, Zaire Ebola virus vaccine is being used in the ongoing 2018-19 Ebola outbreak in Democratic Republic of Congo. Initial data, you see, indicate that the vaccine is highly effective. Prevention and control. Good outbreak control relies on applying a package of interventions, including case management, surveillance, and contact tracing. A good laboratory service, safe burials, and social mobilization. Community engagement is key to successfully controlling outbreaks. Raising awareness of risk factors for Ebola infection and protective measures, including vaccination, that individuals can take is an effective way to reduce human transmission. Risk reduction messaging should focus on several factors. Focus factors. Reducing the risk of wildlife to human transmission. From contact with infected fruit bats, monkeys, apes, forest antelope or porcupines, and the consumption of their raw meat. Animals should be handled with gloves and other appropriate protective clothing. Animal products, blood and meat should be thoroughly cooked before consumption. Reducing the risk of human-to-human transmission from direct or close contact with people with Ebola symptoms, particularly with their body fluids. Gloves and appropriate personal equipment should be worn when taking care of ill patients. Regular hand washing is required after visiting patients in hospitals, as well as after taking care of patients at home. Outbreak containment measures, including safe and significant outbreak containment measures, including safe and dignified burial of the dead, identifying people who may have been in contact with someone infected with Ebola, and monitoring their health for 21 days. 21 days. The importance of separating the healthy from the sick to prevent further spread, and the importance of good hygiene and maintaining a clean environment. Reducing the risk of possible sexual transmission based on further analysis of ongoing research and consideration by World Health Organization Advisory Group of the Ebola virus disease response. World Health Organization recommends that male survivors of Ebola virus disease practice safer sex and hygiene for 12 months from onset of symptoms, or until their semen tests negative twice for Ebola virus. Contact with body fluids should be avoided, and washing with soap and water is recommended. World Health Organization does not recommend isolation of male or female convalescent